Hello, you guys. So, a couple of days ago, I asked you to tell me what you want me to speak about on here, and I got quite a few, suggestions. So, we're going to start with this one here, talking about the EMREE exam, because right now it's EMREE season. Why not? So, I'm going to tell you everything, most of the things you need to know about the EMREE exam. By the way, I'll be holding this, it has all my notes so I don't forget, and I can tell you guys everything. If you're new here, my name is Chibs, Dr. McGallagher, and I'm a medical doctor pursuing residency in the UAE. So let's just jump right into it. What is the EMREE? EMREE stands for Emirates Medical Residency Entrance Exam. The best way to describe this exam is it's like USMLE Step 1, PLAB. It is the exam that allows you to apply for residency here in the UAE. This exam is mandatory. There is no, you can't be like, oh, I took the step one, can I be exempt? No, it's mandatory for all the residency programs here in the UAE. Doesn't matter if, DOH, which is Abu Dhabi, if the residency program is through DHA, Dubai, MBRU, which is also Dubai, EHS, which is for the all the other Emirates. Let's talk about eligibility. To write this exam, you have to have your MBBS or MD degree from a recognized university, and you have to have done at least 1 year of internship. So this internship thing, some universities, their last year of medical school is considered an internship. Some are not, but you have to have official document saying you did your internship, right? And your documents have to be attested. Just Google UAE attestation of documents. Your documents have to be attested. Okay, let's talk about the exam format. This is a computer based exam. It's 120 MCQs over 3 hours, better than 8 hours, right? And the questions are scenario based. So 75-year-old man walks into the AED presenting with blah 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 blah. I've spoken to some other residents and they've said sometimes there's also recall questions like what is, So just make sure you cover your bases. So the pass mark for the EMRE exam is 55%. I think this year was 55%. Now we're not aiming for that, right? If you want to be competitive in your whatever residency program you're trying to apply for, aim for at least above 80%. The score is valid for 2 years. You can't write the exam again to like better your score until 2 years has elapsed. And if you fail the exam, God forbid, if you fail the exam, you have 4 attempts. Let's not talk about the exam schedule and what it costs. So the exam runs from December to March. And there's 2 test dates in every month usually, so about 8 test dates during that period. I think from what I've seen and heard is you're better off writing the exam early, like in December, so that you have time to get your documents attested, just to have time to give yourself to get your ducks in a row because residency application runs from January to March. But if you're not able to do December, I would say latest January. Keep in mind that you have to travel for this exam. The only venue for this exam is here in the UAE, and the exam costs about 1,000 dirhams, which is about 275 US dollars. Other preparation tips or materials, I'll tell you what I'm planning to write this exam this year in December. So I'll tell you, what I've come across. Essentially, first thing people tell you is past papers. Go through scour some past papers and go through them. But I would suggest your knowledge, you have to know your stuff before you get into these past papers. And then number two, use materials that you would use if you were, let's say, planning to write step 2 CK. So Amboss, Border and Beyond, First Aid, such things. How long should it take you to prepare for this exam? Well, most people say if you've got a good clinical knowledge base, 1 to 3 months is okay. If you're starting from scratch, 3 to 6 months. But I say if you know when you want to write the exam, so if you know that you want to write the exam this year in December, like I am, start now. Slowly, 2 hours every day, start now going through questions because you want to be competitive. You want to get the best possible mark you can get. Okay, so my final thoughts are this is The EMRE will open the door for you to apply for residency, right? But it's not the only thing. It's just one part of a whole thing of the things you have to do to be successful in getting a residency spot. So yes, do great on your EMRE. It will open the door for you, but there's a lot of other things you need to consider, more especially your portfolio. Build your CV. Start, give yourself time. If you, I'm assuming the people who are around here, it's a bit too late for you to write the exam now. So let's say you're planning with me. We're planning to write December this year. Start building your CV now. Get into some research, do extracurricular activities, do skill certificates, get some skill certificates. Um, yeah, just start to build your CV, because all that put together is what's going to make you successful. All right. If you have any other questions, let me know in the comment section or send me a DM. Otherwise, have a lovely day.